Hello and good morning to our wonderful Sama Dog community and everyone else that is tuning on this morning to watch this very special Facebook Live this morning. We're so excited to be here with this beautiful lady and her furry companion next to her. This is Cynthia Ingram, and that's Tori down there. And they are an amazing dynamic duo that are therapy. She's a therapy dog, Tori, and together the two of them serve and love and care for many patients and their families through the Cancer Treatment Centers of America. And they are located in Chicago, the two of them, and that's where they serve. There are many campuses of the organization. There are 5 campuses, actually. So they're up there in Chicago, so maybe we have some viewers tuning in from that area that know these two or maybe have some experience with them or met them. So Cynthia and I met, or we call her Cindy, and I met at the Chopra Center, and we really, of course, just in that space of love and meditation and connection, we noticed that our heart calling was so similar and had some wonderful conversations about that. And I'm just so grateful to have the opportunity to give them a platform and give them a place in which they can share the beautiful work that they do with the world in an even broader way. Hopefully many people around the planet will watch this and be touched and inspired by the work that therapy dogs can do. And animal-assisted support, animal-assisted therapy for healing of all kinds. So I just want to stop for a moment and welcome Cindy and Tori to our Sama Dog weekly show.
Thank you so much. We're very excited to be here.
Yes, and we're very grateful for you taking the time to and just being willing and staying connected with us and with Sama Dog and all your encouragement. So let me give a little bit more formal introduction of you two, and then we'll get into some of our questions. We'll also open up the line. I see that there's a couple people on with us, so hopefully we'll be joined by a few more. Definitely let us know if you're here. Hi, Rashawn. Oh, great. Yes, definitely let us know as you're jumping on, friends. And we're on this different platform, as you see. This is called Be Live. It's a way in which you can obviously stream in someone from a different location. So you'll notice that it looks a little different. And we definitely want to hear your feedback and your comments. We want this to be really engaging. So please don't hesitate a moment to let us know and your thoughts and your feelings about this conversation, or any experiences you may have had with animal-assisted therapy. And, I know that the animals in my life have healed me so deeply. And so, they can touch our hearts like few other beings ever could. And there's so much potential in that. And that's what Cindy and Tori get to experience every day. So I can't wait to hear more of their stories. Mm-hmm. So a little bit more about them is that Cynthia Ingram is an RN who serves as the animal therapy coordinator for the animal assisted therapy program in the Mind Body Medical Department for the renowned Cancer Treatment Centers of America. And Cindy and Tori are at the Chicago locations, as I mentioned, which they have 5 different campuses, the Cancer Treatment Centers. A personal part of my story, which I shared with you, Cynthia, and also with your colleagues, is that my uncle Bob, who unfortunately did pass away a couple of years ago, he was treated, his life was extended quite significantly through his connection to and his treatment from the Cancer Treatment Centers in Tulsa. And so when I connected with you guys, it was just that extra special space in our hearts, and why, the synergy is so beautiful when it comes together. So these two are a powerful pair. They underwent extensive training, health screening, and a 22-part evaluation process to become registered pet partners by the Delta Society. And as part of the Mind Body team, Cynthia and Tori visit patients to provide them and their loved ones with comfort, relief, and or distraction from pain, discomfort, and stress, as we can only imagine going through something like that. So Cindy, who is also a certified occupational health nurse specialist, says, her quote is, "I feel the mind-body connection is so powerful in helping patients through treatment. When we walk into a room and it brightens up a patient's day, it generates such a feeling of peace, comfort, and happiness." It brings tears to my eyes even reading that beautiful quote. Mm-hmm. So today we want to talk more about the benefits of animal-assisted therapy and how it can support human healing. And I have, my questions that I would love to ask you as we get into it more, Cindy. But I think the first and most important question to start with is, how did this all begin for you? I love your story of what inspired this path in your Dharma, your purpose.
Well, I would say approximately 2007, my sister was diagnosed with pancreatic cancer. And at that time, I was working at Cancer Treatment Center of America, and I was the director for employee health and occupational medicine. And for a long time, I wanted a dog, but I was a nurse and I worked long hours, and I couldn't figure out how to incorporate that in my life. So after her diagnosis, she wanted to make sure that I was happy and, living my dream. So we talked about that, and I really wanted to pursue an animal-assisted therapy program. I wanted to get involved in that. So that kind of is how the wheels got started. And, I immersed myself into some dog training, volunteering, learning about animal therapy, talked to my current boss now at Cancer Treatment Centers of America, the director of mind body medicine, and she was just trying to get a program up and running. So we were able to meet together, put together policies and procedures. It was approved. And, the ball just started rolling once I figured out what I wanted to do. It was just like amazing. Yeah. I know, it was amazing.
Spread around other campuses as well. Is that correct?
The other campuses also have some animal-assisted therapy, but they don't do it in the manner that we do it.
Oh, I see.
So they don't have, one nurse, one dog who takes care of the program. So we were the first hospital to start. And they do have their versions of how they do it because they recognize the importance of it as well.
That's awesome. And so tell us, there's so much to know around animal assisted therapy and service dogs and the differences even in the terminology. And so will you just kind of paint the picture of what do therapy dogs do and what are the different kind of segments of the work that animals do in healing humans?
Well, if you have a service dog is there to actually provide service for someone who has a disability and allow them to maintain their, their lifestyle with the help of that assistance of that dog. So service dogs aren't for other people to play with and pet. When they're on service, when they're working for somebody, they're actually maybe the eyes of somebody, the ears of somebody, so they actually have a job to do to help protect that person and assist them with their disability. Therapy dogs are there for people to love and provide comfort and support and to kind of, maybe be a distraction from what's going on in their life. Cuddling a dog or petting a dog helps increase endorphins. It helps people feel better. Studies have shown that having animal-assisted therapy helps decrease depression, it lowers blood pressure, anxiety, promotes a feeling of wellness, increases the immune system. So there's a lot of studies out there that support this type of work.
And thank goodness it's coming more and more and more. I've met a few other guests that have come through the Choker Center also that are really taking it on, in a very scientific medical setting, but really looking at the positive impact and getting the research behind it. Because of course, so many of us really want to see that, and we know it intuitively, especially those of us that have that connection to animals. But we'd love to see, how it's affecting all of us and how it's working with the body. And there's a nice close-up of Tori. Let's get that on the screen as well. Tori, hi, sweetie. She's so cute. Such a sweetheart. And how old is she?
She will be, in September this year, she turns 11. I can't believe it.
Wow. And you guys, so you guys have been doing this for over a decade now.
Right. It's amazing.
Yeah.
Just amazing.
So tell us a little bit about, sorry, Cindy, what did you say?
I was just going to say she's impacted so many lives and, really provided so much love and support and comfort, whether it was for a patient or their family or the stakeholders at CTCA.
Yeah. So tell us a little bit about, what is it? What's your favorite part of the job? Well, for two actually things. What makes you guys so unique? Because I know there is kind of a, this isn't the the offering that the two of you can bring forward to patients and their families is different than most anybody else. So tell us about that. And secondly, what do you love most about what you do?
Well, first of all, it is a unique pairing. As a
Built it, yeah, perfect.
There we go. I'm a registered nurse, and I've worked for a number of years in a variety of settings with people from all different types of ages and illnesses. And so I feel like, it's kind of like a full circle moment for me where I can actually bring love and comfort and support in a way that a nurse can to patients who are really having quite the challenge of their life when I see these patients that we're dealing with, or maybe their family members. So it's really a beautiful thing to be able to assist people through such challenging times, and in a simple way. We just walk through the door, and someone who hasn't smiled in 3 days is smiling, and just the energy that generates in the room and what that does for the family. Just to see their loved one respond to something when they're not responding. So it's really beautiful to be part of that journey.
Mm-hmm.
Tori and I, we work really well together. She's amazing. I mean, she is just amazing. She really knows her job well. She loves her patients. And the minute her jacket is on, she goes to work and she provides love and comfort and support. And she does it in such a wonderful way. I'm just really proud of her. And, I'm really proud that I'm able to do this work, because it does, every day we make a difference in someone's life. A lot of times with medical procedures or different things, maybe you're walking in to give someone an injection. Well, that doesn't feel good. The outcome will be good, but the actual injection doesn't feel good. Well, when we walk in a room, it's just peace and love and support, and people can be whoever they are.
Yes, dogs have a remarkable way of giving us permission to be free.
Yes.
Permission to just be ourselves. And I can imagine in those kinds of situations too, in any tense or difficult situation, that's where dogs can just be such an angel, because they're just pure. They have no expectations. They don't need you to look or say or do anything. They just want to be with you. And it's very rare that we find that kind of relationship. And it sounds like Tori's quite the expert at it.
Yes, she's pretty good at it, I have to say. I'm really impressed with her ability and what she's able to do with people. So
yeah, intuitive. I'm sure that's probably a very inspiring thing. Has it taught you some additional skills, or is there anything in particular that she's taught you by watching her?
I used to do this work, and I used to feel at the end of the day so tired. I didn't want to talk on the phone. I didn't want to really, do things with other people. I was just really tired. And one thing she's taught me is she's tired too. So it's part of what we do. It's part of the work, you give. And when you come home, you need to recharge and take care of yourself so you're able to do that again tomorrow. So that was something she taught me to, just feel good about what you do during the day, and it's okay to take care of yourself.
Yeah, that's a great lesson. So I would love to hear a story, like a particular story, or maybe of a particular patient or a family member that when you just really saw a powerful experience, an exchange, or a moment, a special moment between Tori and someone. Tell us something.
Well, I have many of those every day. I'm really, really lucky, to be able to be part of that with people. There have been many times where people have said to me that when Tori walked in their room, just at that time, they knew they were going to be okay, and they were going to be able to continue their journey and to move forward and do whatever needed to be done. And to me, that is just such a blessing that they, were able to come to that point just because she walked through their door, So that's pretty amazing.
That is amazing. And like you said, that you get to experience that on a daily basis and feel that love and healing for yourselves. Kind of, I always think of the reciprocal relationship, of course, it's also so deeply healing for you and Tori.
Exactly.
Flow like that.
I mean, recently, I had taken care of somebody who she contacted me because she wanted help relaxing. And so we did some breathing together, and she told me about a story where she's very apprehensive to come for treatment because she had to leave her son at home who was autistic, and she wasn't sure how he was going to handle it. And so she asked me if there was any tools I had for her to take back to him. So I made a little care package for her son, which included a few magazines that Tori was in, Tori's bookmark, and a breathing technique. And so she took that back and she worked with her son. And then every time she'd come back for treatment, every, 3 weeks, she'd contact me and let me know how things were going and that he was doing good. And so she had decided to bring him to the center because she didn't have someone who could watch him for her next treatment. And so she brought him in, and it just happened to be Tori's birthday, because every year Cancer Fighters has a surprise party for Tori for her birthday. So
otherwise, you just don't want her to know ahead of time,
Right.
Like, be like nervous or
not another party. No. So she had contacted me, and she found out it was Tori's party, so they went and they bought a gift, and this was a big deal for her son, and bought a beautiful card and drew a paw print on there, and he wrote her something in the card. And so we had connected, and he wanted to give her a present, so we did, and it was lovely. And then he thanked me for the breathing technique because he said he'd been using it and it really helped. So later that day at her birthday party, I didn't think he'd come because it's hard for him to be around people. Well, sure enough, she had a scan and he came down to participate. And he just, you would never know that he's not comfortable being around people. He played with her,
Wow.
He threw a ball, he hung out. And at the end of the day, he hugged me twice and thanked me. And he doesn't hug people. He doesn't like to be touched. So it was really like a full circle moment, and it was really beautiful. And I mean, it's amazing, and for her to see her son when she came back from the scan, to see him actually, integrated with people and, relaxed and enjoying himself, it was wonderful for her too.
Oh, and so healing. So healing, just imagine how much more powerfully her treatment is working when your body and your mind and your heart is so open like that. So
Exactly.
Great. You're showing right there that Tori has a huge ripple, as we would say, this ripple that is far beyond the patients. And it's just, there's nothing that really, like we said in the beginning, there's nothing that human beings can do really to replace the kind of love and acceptance and space holding that a dog can. And so for that little boy, he feels that. Humans have been trying to open up, I'm sure, for a very long time. And yet a few minutes with Tori does all that needs to be done.
It's pretty amazing.
It is. Shows us that sometimes our words, we fill in all the blanks with all these words, right? And when working with animals, you really see that all those words are not necessary.
There's many times I'll go in a room and maybe someone will cry for the first time because they're finally actually letting themselves realize, what their diagnosis is, or they're thinking about that, and they'll just hug her and cry with her. And sometimes I don't need words. I just kind of let, the situation happen. Sometimes, like you say, there are no words. It's just about her providing love and comfort.
And do you notice when people get really emotional, or I'm sure they go through the range of emotions, angry, confused, frustrated, do you notice in Tori responding differently to different emotions?
Well, sometimes I think that, she's really great with people who are really welcoming and, dog people. But a lot of times there have been people who really are not dog people that at first they're like, well, just let me look at her. Oh, she's so pretty. And then all of a sudden they want to pet her. And then, so, you know, she gives them a big warm welcome, and you can just feel, and you can, you know, feel the peace in the room, just because, you know, they went that extra step, which they normally might never have had, you know, the ability to do. So it's quite amazing.
It sure is. So with that, I'm sure there's some people that are watching this now or will be watching this later that will be wanting to access animal-assisted therapy, access the two of you if they're in that area. But before answering that question, I just want to pause for a moment and welcome anybody else that has jumped onto the line. I see several of you have joined us, and we're very grateful for you being here. We are talking with Cynthia Ingram and her therapy dog, Tori, who has stepped out of the scene for the moment, but I'm sure she's listening from the sidelines. She has a lot of spotlight put on her through the week. So, you know, Cindy was saying, it's Saturday, it's her day off, so she's a little confused. She has something to do. But anyways, this duo is remarkable in the way that they have really been pioneers in bringing animal-assisted therapy into hospital environments, specifically into the cancer treatment centers of America. They're at the campus of in Chicago. There's Tori now, looking out the window, thinking about, I know, recapitulating her week and thinking about her intentions for next.
Exactly.
Yeah, so I'd asked a question before that little interlude, and please do, anyone jumping onto the line that's there with us, please let us know that you're here. Great to see you, Helen, Rushan, and I see my mom's watching too. And please let us know if you're here. Do let us know that if you have any questions, comments for Cindy or for Tori. Cindy can channel Tori's answers to you, so no worries on that. They are telepathically connected like that. And or just any comments, any experiences that you may have had, whether it's with a formal service dog or therapy dog or not, just with your own pups, any healing experiences that you've had, we'd love to hear them. So just go ahead and comment below. Please share this out there with anybody else in your network that you think would be interested in this conversation, that has a connection to animals and healing. And you know, that's what Sama Dog is all about, well-being for dogs and their humans, and very much appropriate for our conversation that we're having today with this two that have totally devoted their whole lives to this work. So with that said, before all of that, I asked you a question, which was, if someone's listening and wants to get connected to animal-assisted therapy, or specifically to you two, if they are in the Illinois area, perhaps, how do they go about that?
Well, we routinely see patients at our hospital, their families and stakeholders at our hospital. And so if a patient or family member comes in, a lot of times Tori has a business card, so they email Tori or they will call. I am her assistant, so I answer her calls. So they just have to call and leave a voicemail with their name and number, and then we call them back and we fit into their schedule however we can. So we, you know, sometimes have private meetings, sometimes we have group meetings, just depends on the situation. On a daily basis, we visit inpatients who can't get out, and we also see a large volume of outpatients who come for infusion, radiation, that type of thing.
Mm-hmm. And is there a database or anything like that that is accessible from other parts of the world?
Well, what I would recommend, whatever city or state you live in, you could jump online and look up animal-assisted therapy, and there's a huge volume of different providers. Like, we've worked through the Delta Society, which is now Pet Partners, and now I'm affiliated with Intermountain Animal Therapy, which is out of Colorado. So there's a variety of different organizations that support animal-assisted therapy.
Mm-hmm. Fantastic. And you were telling me about that location in Colorado. Will you repeat the name again?
Intermountain
Animal
Therapy.
Sounds like an extraordinary organization. So we have a couple questions coming in, and so I'll put them up on the screen, Cindy. Here's one from Rushan, a beloved member of our Sama Dog community. She says, what does it take? This is a great question. What does it take to have a therapy dog, and what's involved?
Okay, well, I'll just tell you, basically, I got Tori when she was 4 months old. So you can start treating your pup very young. And you would, there's 5 classes, at least in my area. So it's obedience, advanced obedience, canine good citizen, therapy dog, and then you take your therapy test. So each class is about 6 to 8 weeks, and we would take the class, and then I would work with her every day for a couple of hours every day, just practicing whatever we were taught in class. So, and then we retest every 2 years for our registration.
That's awesome. And it's available. That's kind of what leads into our next question by Roseanne. She says, is there a cutoff age to train your dog? So I was wondering, is it available to any dog? I mean, of course, behavior is a big qualifier here, but yeah, how does that work?
It is available to any dog if you go through the classes. So you may have a dog that's really good in obedience just because you've worked with them. Then you could jump ahead into the other programs. So a lot of times golden retrievers are puppies until they're 6 years old, 7 years old. So we see a lot of golden retrievers coming for the first time through a therapy program here, where I'm affiliated with Dogs of Endearment. It's a group, and it's not uncommon for the first time for them to get their animal therapy registration process at that age. So as long as your dog is healthy, they have to be at least 1 year old to go through the program and to get the registration process.
So it sounds like Roseanne's 11-year-old dogs have potential.
They would be awesome, I'm sure.
Because I can imagine too, for seniors, maybe that her dogs, Roseanne's dogs, become service dogs, therapy dogs, in senior facilities or in senior care, because senior people, humans with senior dogs, can be a really beautiful combination too, because they really get each other, you know.
It's kind of interesting. One thing I've learned about working with this field is people, dogs are like people. Like a dog can't do every job. So there's a specific job that's good for your dog. Maybe your dog doesn't want to be like maybe an Alzheimer unit because it's so loud. That might not work for your dog, where being a reading dog at the library with kids may work. So you need to figure out what your dog's niche is, and you only figure that out either by shadowing people or figuring out, taking them different places and seeing how they react.
Yeah, very true. Every single one. That's what Ayurveda really guides, is that every single one of us, including every single dog, is a unique individual and should therefore be treated, handled a little bit differently in everything from their food to their environment to their job. I can imagine a Vata dog, very social, very friendly, very talkative, probably, a job similar to Tori's, where a Pitta dog would want probably more of, I'm just guessing here, but just knowing kind of the tendencies of dogs. A Pitta dog, I think, would want a service job, a service dog job. It wants to be the eyes, it wants to be the ear, it wants to be on. That's what Pitta's like. And then the Kapha dog just wants to be like the sweetest dog that lays and loves and is like this big goober of joy to the people around it. And so with that said, I've never asked you this, what dosha do you think Tori is?
I think she's Vata Kapha.
Good combination, perfect combination, in fact, for what she does.
Yes, so that's what, and actually that's what I am too. So I think we make a good team, because when I'm coughed out, she's can Vata me through, and
it's great.
We're a good team.
Yes, you guys are. Oh my gosh, you can feel that through the airwaves even. You really can. I'm sure our viewers are feeling that as well. So just a quick mention, what we're doing here for those of you that are just joining on with us. This is Cynthia Ingram. She's a registered nurse. Her therapy dog is there by her side over there, Tori. Tori is, as a 10-year veteran of, well, both of them are over a decade now serving at the Cancer Treatment Centers of America at the Chicago campus, seeing patients and their families and their loved ones every single day and bringing love and healing and comfort to those that need it most at the time that they need it most, at least. So, okay, we have another question. This is a good question from Stacey asking, how does Tori decompress after work? Is it emotionally draining?
Well, I'm glad you asked that question. That's really good. Part of the program training and the registration process is the fact that I'm always her advocate. So I'm always looking out for her to make sure she's in a safe environment, that she's okay. You know, sometimes your dog may get anxious or be uncomfortable. If that was the situation, you'd remove them from the situation. And another thing, we have to provide breaks. She can only work for 2 hours and then she has to have a break. So basically, she works for about an hour and a half and then she sleeps for a couple of hours. And, you know, and I remove her from the situation and then I'm doing other things. And then she goes back to work a couple hours later. So when she comes home, she gets a greenie for a job well done every night.
Uh-huh.
And, you know, then she runs around the house a little bit and then she takes a nap. So it is emotionally draining. You know, she does it, we do it full time. And so by the end of the week, I can tell she's tired too. But she does a good job.
Yeah. And what about for you?
Same for me. By the end of the week, I'm tired too. I like to just have some good self-care. So, you know, I like to exercise every day and, you know, we go for a lot of walks and meditate.
Beautiful. Do you notice, Cindy, that your Chopra Center work and teachings, understandings influence what you do, whether it's for others or for yourselves?
I definitely use a lot of the principles I learned. It strengthened some things and, you know, gave me new insights on other things. So I definitely use the course quite a bit.
Mm-hmm.
I loved it. It was one of my best life experiences ever.
Oh, that's so great. And what a blessing that, you know, we've come together there too. You know, it never ends, the blessings of the Chopra Center, actually. They just go on and on. So what I'm curious about is, speaking now of you know, the center here in Carlsbad, now let's speak about your center in Chicago and on the other 4 campuses. There's 5 total, is that correct?
5 total. Sure. We have
what
Chicago.
Else do there? What else? Yeah, tell us about where they are, the other 4, and what else do they do at the Cancer Treatment Centers of America? They're so widely respected and, you know, really paving the way in this treatment and the mind-body connection. So tell us more about them.
Okay. Well, we have a campus in Chicago, Atlanta, Philadelphia, Tucson, and I'm forgetting one place. Phoenix.
Aha.
Uh-huh. Okay, Tulsa. So Atlanta, Chicago, Philadelphia, Phoenix, and Tulsa. And then Chicago, obviously. So, you know, Cancer Treatment Center, the one that I'm at, the Chicago site, has been around for over 30 years now. And we've grown into a national network, you know, of the 5 hospitals that I mentioned. And we take an integrative approach for cancer care that combines surgery, chemotherapy, immunotherapy, with advancement in precision cancer treatment and supportive therapies designed to manage side effects and enhance quality of life for people while they're going through treatment and after treatment, so they have an improved quality of life.
Mm-hmm.
Our vision is to be recognized by people living with cancer as a premier center for healing, hope, and we are the home of integrative and compassionate cancer care. We never stop searching for and providing powerful, innovative therapies to heal the person, improve quality of life, and restore hope. So it's an amazing place to be. It's wonderful to be accepted by people that are on this journey, you know, when they're in it could be such a difficult time in their life, and they accept you, and we're all like one big family.
Mm-hmm.
So, you know, we talk about that we deliver the mother standard of care, and we treat everybody like they're a family member, and they treat us like we're part of their family. So it's just wonderful. I've worked there since 2004, and I really enjoy working there.
I bet, especially because you guys have found such a place there. One thing to be an RN there, as you were, but then to take that next step again into Dharma, into your unique, it's so interesting. That's one of my favorite things about meeting people and having deeper conversations and getting into their stories, because you see the way that every step of the path, every brick in the road has been laid perfectly and very intentionally by, some would say, a higher power, our higher self. But there's a story going on that sometimes when we're in the middle of it, we don't realize this beautiful story and the way that it's happening. We even get really tied up in the difficult parts of the story, and this shouldn't be happening. And yet when we can take a step back, we see that everything is falling into place. So that said, when I look at you guys, I hear your story. It's really remarkable to see the way that you got into this and how every step came into your path.
It's kind of interesting because when I would tell people what I wanted to do, they'd look at me like, oh boy, like, how's that going to happen? And so I thought, you just wait and see. I can feel it. It's going to happen and it's going to be amazing. And I mean, another important part of the story is that Tori was actually donated to me from a patient who wanted to give back to our hospital.
Wow.
So, she had she bred these Australian Labradoodles, and she would train them and donate them to people who couldn't afford service dogs. And then through her treatment at CTCA, she really wanted to give back to the hospital. And so she asked me if I would take her puppy and use it for the program. So what a gift. I mean, just amazing.
Amazing. Her story, why every brick in the road was laid too, because the two of you and the lives that have been touched, I mean, there's no way to ever count them. So.
Right. And, we were not probably going to use this method of animal therapy that we're using now if it wouldn't have been for her. So she was, really opened our eyes to a different way of doing things. And I am just so proud of the fact of, what we do. And I'm so delighted that, I was able to connect with her and, look at some different options.
Yeah. Definitely. I want to, we're kind of coming toward the end here, but for those that are just coming in with us, just letting you know who we're here with. This is Cynthia Ingram, along with her therapy dog, Tori. This dynamic duo is out of the Cancer Treatment Centers of America, the Chicago campus, and they are out there on the front lines, if you can say that, really just face to face, heart to heart with the treatment, or the cancer patients who are receiving treatment, as well as their families, their loved ones, and just showing up to serve every single day. So Cindy, I'm curious, because everything you get into has its good and bad, or maybe not bad, but it has the struggles and the triumphs, right? So what about this work actually surprised you? Maybe it's difficult, or you didn't expect it, or it's the thing that you've kind of had to learn to overcome?
Well, I guess probably from a more of a holistic approach, I probably wouldn't, if I had a dog on my own, I may not, do all the vaccines and frontline and all that type of thing that I'm required to do to keep her safe and to keep our patients safe. Mm-hmm. So the other thing is she has to go every 6 months to have testing done. So she gets a couple of cultures done, and one's a nasal culture, and she doesn't like it, but it's for our patient safety and her safety. So I think that's really the only thing that is, tugs at my heartstrings, mm-hmm. because I know she doesn't really like to do that. And I mean, I do believe that, there are, you should have some vaccines and some treatments, but I'm also, more of a holistic approach. So there's that, I go back and forth with that. So I do definitely think that it's a beautiful blend to have Eastern medicine with Western medicine. So
yeah, that's what we're all about too. And it's really a beautiful thing. And I was wondering about that with you guys. And I thought that probably, I didn't know the exact requirements, but of course they're probably quite high and regulated. And we know when we get to that kind of traditional regulation standard. It does tend to not be very holistic. And so I wondered how you dealt with that or thought about that. And offline, I can offer some suggestions to help, at least, to detox her after she does get the treatments, or the vaccinations rather, or the preventatives. We can do a little bit of detoxing to just make sure that residual, what she doesn't need, isn't held in the liver and the kidneys. So we can talk offline and get into that a little bit. I'm happy to help you guys for all the help you've given to so many others.
Oh, thank you.
Yes. So we're going to be closing up here in a moment. I just want to say thank you to Sherry and Noemi and Stacy, Roseanne, Rushan. Karen is here also. And Judy also is watching. Karen says they must be together. So thank you all for being on the line with us. We will be replaying this, many, many days into the future. It will always live on my website. I'm going to make a special blog and have this featured within it because it's been absolutely wonderful to share time with you too. Tori's, it's her day off. So what can we expect? We can expect her to be in the camera the whole time. Tori, we're talking about you, sweetie. Yeah, she says. So Cindy, what are your closing thoughts? What would you like to leave our audience with?
Well, I want to thank you for taking the time and giving us this opportunity and forum to talk about what we do and to let people know that CTCA is a wonderful place. If you have a need for cancer care or integrative cancer care, we do both things there, and it's really a wonderful place. I really have enjoyed being a nurse. I've been a nurse for a long time, and this has definitely been one of the highlights of my career and my life, and I love, getting able to know people and work with Tori in that way. So it's been a true blessing and a true pleasure.
Oh, well, thank you so much from the bottom of our hearts and from the bottom of the hearts of everybody that you've ever touched. It makes me emotional thinking about it because you know me, a big softie about this dog stuff. But when I just think of all the people that you two have blessed, including me, and I'm so grateful for that. So thank you for your beautiful service, and thank you for the best time that you have. Yeah. So we look forward to staying in touch. Way to close up an interview with getting all teary. Sorry. But it is very touching, and you're just, to share time with you is an honor, truly, because it's just like to hear the stories and to be inspired by the work you've done is what it's all about. Definitely what Sama Dog is on the planet to do is to share this wisdom. I know that if I was in the situation of cancer treatment, there's nobody that I would rather by my side than the two of you. So.
Oh, thank you so much.
Yes, of course. So lots of love to you both. Please give Tori a good butt scratch and maybe like a full body massage, maybe even a little bit of chakra balancing when she's done with all of this as a thank you from us to her.
I will do that indeed.
Thank you so much, you guys.
Namaste.
Namaste. Bye for now.
Bye.